వచ్చేస్తాం. నాకు మీరు చెప్పు.
స్క్రీన్ వస్తుందిగా.
ఏం లేదు సార్, చేసి చెప్పుకోవచ్చు. ఓన్లీ మీరు పవర్ పాయింటా లేకపోతే
దిస్ ఇస్ ఓకే, ఇచ్చాను
చెప్పేసి మామూలు ఇది మినిమైజ్ చేసుకోవచ్చు.
అంతేనా?
ఏం కాదు సార్,
మీరు స్టార్ట్ ఎక్కడ చేయాలి?
ఇంకా స్టార్ట్ ఏం చేయను అసలు, నేను చేస్తాను.
నవ్ ఇట్ స్టార్ట్.
కెమెరా ఆన్ ఉంది.
ఓహో, ఆన్ ఉందా?
చూపిస్తాను నేను.
ఒక్కసారి నాకు కొంచెం అట్టుకోవచ్చా? పర్వాలేదు.
చూడండి.
మీరు ఉండలేదు,
ఓకేనా?
ఇక్కడే కనపడదు అనమాట.
జస్ట్ ఈ స్క్రీన్ కనిపిస్తుంది, మీకు చిన్న బొమ్మ ఇక్కడ వస్తుంది.
ఓకే. గుడ్ ఆఫ్టర్నూన్. There was some technical problem in the last class. I think audio was not working properly. Anyway, now I think it's clear for you. I take it for granted that you are able to listen to me. Yeah. Today we will talk something about the fractures of the skull, because we are talking the renal injuries. In the last class we discussed about the soft tissue injuries of the head, scalp, face and all. So today we will discuss about the injuries to the skull. You know, the skull is made up of two tables, the outer and the inner table, and outer table is twice thicker than that of the inner table. And in the young males, the thickness of frontal and parietal bones is about 6 to 10 millimeters, and the thickness of occipital bone will be around 15 millimeters. And if you take the temporal bone, that is the thinnest bone of the about 4 millimeters in thickness, and the skull is thicker in the mid frontal, mid occipital and paretosphenoid and paretopetreus matrices. See, all this anatomical structure thickness is important as we discuss about the fractures of the bones, fractures of the skull bones, right? So because wherever the bones are thin, the fracture lines tend to pass through that bone. So it's just information what's the various thickness of the skull bones, what you see in an young male individual. If we discuss the types of fractures skull, we'll discuss the first kind of fracture is known as fissured fracture. Fissured fracture is otherwise called as a linear fracture. Fissure or a linear, a small line, hairline like this. So they are produced by general deformation of the skull, and these linear fractures, they involve the whole thickness of the bone, or it may involve only inner or outer table of the skull. And if you go by statistics, 70% of the skull fractures are of this variety. They are either fissured fractures only. So the outer table of the skull is capable of rebounding to its normal shape, while the inner, which is thin and more brittle, is more susceptible for the fractures. So this fissured fracture could be alone, or it may be associated with the other types of fractures which we are going to discuss now. And these fractures, how they are caused? These fractures are caused by forcible contact with a broad resisting surface. The force is applied onto the broad resisting surface like that of the ground, or with a causative agent which has got a relatively broad striking surface. Not a sharp instrument like an axe or an, but it should have a broad surface which is in contact with the skull. So either it should be a fall onto the ground on the broad surface, or the causative agent must have a relatively broad striking surface, or it can also cause when there is a fall from the height on the buttocks or on the feet. When a blow is struck onto the side of the head which is free to move, see, if there is a blow and if the head is not fixed, if there is a blow from the right side, the head should be able to move onto the left side. If it is a free head, yes, it will move. So when the blow is struck onto the side and the head is free to move, the fracture actually starts at the point of contact, and it always runs parallel to the direction of the force. And if the head is supported, or if the head is fixed, then the fracture may be on the opposite side. It is known as a counter pressure. So it can be on the other side, the counter hook fracture. Or if the head is fixed on both the sides. So the fracture may be starting at the vertex on the top of the skull, or it can be at the base, and the fracture line is always along the parallel to the line of the force. So a fall, suppose an individual falls onto a flat surface, there may be one or several fractures, and these lines, they radiate from the line of the impact, from the point of impact, and usually there is no associated depression at the point of impact. And when you are examining the patient, an extensive hematoma of the scalp, I said there is no dent, there is no indent at the scalp, the fracture line starts from the set of impact, but when you examine, there is an extensive hematoma in the scalp which shows the point of impact or the site of impact. In general, an injury of the head sustained by a fall is mostly situated in the level of the margin of the hat. I think it is clear for you. When I say the margin of the hat, it is a circumference reading. Suppose somebody keeps a hat, so there circumferentially the hat margin is in contact with the skull, and if there is a fall, the injury is almost always at the level of margin of the hat only. While an injury due to a blow, somebody hits onto the vertex of the skull, and then injuries or the fractures, they are seen commonly above the level of this margin. And when there is a linear fracture or a fissured fracture, it tends to follow an irregular course. It can go in a straight or irregular based on the thickness of the bone, because it chooses the thinner bone, and also the direction of the force and the surface and the contact area. So the fracture line tends to follow an irregular course and is usually no more than and hair's breadth, which is a hairline fracture, very thin fracture. I think hairline breadth means difficult to measure in the naked eye with the naked calipers, but yes, we normally call you are all aware that an hairline fracture, a very thin fracture, is normally a characteristic of linear fractures. And sometimes this fracture will travel for some time from the site of impact, and it may follow the suture, a skull sutures in the bone. It may follow along with the sutures. It can travel along with the suture for some time, and then again it may come out and take a different route. So in the course of the fracture line, partially in the beginning it may be out of the suture, then it may follow the suture line and then take a different direction after traveling in the suture for some time. So this fracture line is always definitely because of hemorrhage. It may be looking red, and even many times you may not be able to see the hemorrhage. So during autopsy, what they do is, whenever there is a suspected fracture and when it is clearly washed, they allow a blood to run over the suspected area. Put a little blood and then let this blood run over the suspected area of the fracture, and then it is washed. And this blood, whatever is put onto the skull, is seen as a fracture line in the once it gets into the margin or into that fracture line. Otherwise, it may be missed. And one more thing, these linear fractures, they do not cross the bony buttresses. Buttresses, thick bone like glabella or a frontal or parietal eminences or a pitreous or temporal bone, and even the occipital protuberances. So they tend to cross the points of weakness I told you. Whenever the bone is thick or there is buttress, it will not cross it. So it tries to take a direction where the bones, or when there is a point of weakness. Normally it is like over the frontal sinuses, on the orbital roof, parietal or occipital squama. So from the site and also the direction of the fracture line, we may try to identify the direction of the injury. From the site and also the direction, we may able to know the direction of the blow onto the scalp. So suppose if there is a blow onto the glabella, I said it's a bony protuberance, then there may be a shattering of ethmoidal sinuses and roof of the nose. Suppose, let us say, there are multiple blows onto the head. If a person has got an abnormally thin scalp, a minor violence also may cause a fatal fracture, because he has got a very thin skull. The fracture lines, normally they stop when the energy dissipates. It will travel for some time and it stops where there is the dissipation of the energy, or when they meet a foramen. See, when it comes to contact to a foramen, then the fracture will stop there. Or if there is a suture, I told you sometimes it can pass along with the sutural line, but sometimes even it stops at the line of sutural line. Or if there is already a pre-existing fracture is there, the new fracture line will go, and when it comes in contact with that, it will stop there. This is the characteristics of the linear fracture. And about 20% of the linear fractures are not found on simple X-ray. So this is, I told you they are very thin fractures, hairline, and about 20 to 25% may not be detected on the simple routine X-ray of the skull. So in the case of the blow, and if there is a subsequent fall, the fractures which are produced from the fall, they are arrested by the earlier fractures which are caused because of the blow. I told you the first fracture, if there is there already because of the first injury, if the second injury also causes a fracture, this fracture line will travel, and when it reaches the first fracture line, it will stop there. So if the two blows are struck, the same results, again see, the first blow will produce a fracture, and second blow, the second fracture will come and stop when it comes in contact with the first fracture. So this may be possible, because why I am telling this is, here it is possible to determine which was the first blow. See, if there are multiple injuries, at least which was the first blow, you will be able to say, if you know this pathogenesis or this behavior of the fractural line, or a linear fractures which happen because of multiple blows onto the skull. Suppose because of the first blow, the skull, because there is an injury, the skull cap, the diploid, the outer and the inner tables may become little weak because of some degree of damage, and the subsequent blow, even if it was of less severity, it may cause the degree or the damage which is out of proportion to the pressure exerted on this, because already it is a weak structure because of the first blow. See, this is the reason why when there is a fight, a scuffle, the anterior blow onto the skull, say around the eyes, on the orbits, they produce linear fractures, and they are often bilateral fractures, and they cross middle line through the cribriform fluid and pass posteriorly through the pituitary fossa into the basal portion of the occipital bone. So the blow onto the orbit, I told you the medial part of the orbit and the floor of the orbit are weak. So the fracture always tend to happen on the medial or the floor of the orbit. And I told you the fat, the soft tissue can herniate into the roof of the maxillary sinus, which is just below the orbit. And it, on an X-ray, I told you it looks like a teardrop, which is known as Raypool sign when I was talking about soft tissue injury on the face. So this is because of the weakness of the medial and the floor of the orbit. When the pressure is exerted, the protein or the soft tissue can herniate into the maxillary sinus, roof of the maxillary sinus, and it is the floor of the orbit. Normally, the human adult head, it weighs about 4.5 kg. And a linear fracture of the skull is produced. See, this is the statistical study. If the head is hit on its side by a stone of around, say, it weighs around 90 to 120 grams of the stone, hits onto the side of the skull, then it can produce a linear fracture. The weight of the stone should be between 90 to 120 grams. Or even with the weight of about 2.25 kg is dropped on to the skull from a distance of just about 1 foot. Yes, this weight which is around 2.25 kg, if it is thrown from just 1 foot or if it falls onto the skull from 1 foot, yes, they can produce a linear fracture. This is the statistic. So basically, the linear fractures are because of fall onto the ground where the surface area of the contact is large, or when the striking weapon has got a larger surface and it strikes to the skull, and because of the impact there will be a hairline fracture. It can be on the outer table, it can be on the inner table or complete bone. I told you it will take the direction parallel to the direction of the force that is implied onto the skull. So I also told you where it stops, whether it will cross the foramen, whether it will cross at the bone buttresses, yes. And if there is an existing fracture, this new fresh fracture line will go and stop when it touches the previous fracture line, and all these things are necessary for you to know, to establish which was the first injury, which was the first blow, the direction of the victim and the assailant, for your to come to a medical legal conclusion. The second type of the fracture, the skull, will be known as a depressed fracture. Depressed fracture, depression. The anatomical term itself will know you. When I say linear fracture, it's a continuous thin hairline, and this is a depressed fracture. These depressed fractures are produced with an object which relatively has got a large amount of kinetic energy with a small surface area. That is, the object comes with a very high speed or with high velocity, and the area of contact which comes and touches the skull is definitely small. So when a smaller area comes in contact with higher speed, this small area will, when it comes to the skull, it produces the fracture because of the local deformation of the skull. So when this type of injury occurs, the fracture bone is driven inside into the skull cavity, because it came with a higher speed and the contact surface is small, so it drives the bone fragment into the skull cavity. The outer table is driven into the diploe, and the inner table will be fractured irregularly, and it can be a comminuted fracture. And this is also otherwise called a fracture a la signature or signature fracture. Why it is called signature fracture? Because it resembles the shape of the surface of the object which came in contact to the skull. Suppose somebody hits onto the skull with a hammer. The hammer has got both, so one side will be a little broader and second side will be a small rounded surface. So if an individual hits a person with that hammer with a higher speed, when the surface, the contact surface to the skull, it is the rounded surface, and because it drives the bone inside, the hole or the depression which formed here corresponds to the diameter and that of the striking surface of the hammer. So it is like a thumb impression, a signature. That's why it is called also as a fracture law signature or a signature fracture. And this localized depressed fractures, they are caused by blows from heavy weapon. I told you they should have a smaller striking surface. Even if it is a stone, it should not be a very big stone like a granite with all a rectangular big surface area. It should be having a smaller surface which comes in contact with the skull bone. Or it can be a stick, It can be stone, it can be an axe, it can be a chopper or a hammer, I told you. So all these heavy objects hit with a higher energy and higher velocity, and the contact which comes in contact with the skull should be a small contact surface. And sometimes, of course, very rarely, only inner table may be fractured under the site of impact, and it leaves outer table normal. There is no fracture seen. Or vice versa. Sometimes only outer table also may be involved in the depressed fractures, leaving inner table safe. So when a violent blow with the full face of a weapon completely it detaches almost the same diameter of the bone that will be driven inwards, I told you. And if it is a less violent blow, let us say it was little less speed, then, or if the blow was in an oblique, not at right angles, but if it was hit in an oblique direction, so it may produce a localized fracture with only a partial depression of the bone. So one thing is that part of the skull which is first struck that shows the maximum depression. The first contact, the area of the first contact will have the maximum depression. So let us say if a butt of the firearm strikes the skull, the firearms, they need not be fired even sometimes in the violence as they hit with the butt of the firearm. If the butt directly comes in contact with the skull, the butt may produce a fracture, a depressed fracture, which is in the shape of a rectangle. But only suppose if the corner of the butt strikes the skull, then definitely, because it will be a triangular in the shape, the depression will be in the triangular shape. So the depression fracture caused by a stone, it may be triangular or it may be irregular depending on the shape of the stone. And sometimes a linear fractures also may radiate from the depressed fracture. See, somebody hits, it is not necessary that it will only cause the depression fracture and keep quiet. Because of the pressure from the margins of the depressed fracture, a linear fracture also may be there, because I told you it depends on the direction of the pressure. So if the direction is in this way, the linear fracture also may be seen from the depressed fracture, and that indicates the direction of the force. And antemortem fractures, especially in the case of homicides, they normally appear as the localized depression of the skull. So this is, I think you know the difference how the linear fractures are caused. There the large contact area, here is the small contact area, here the weapon is heavy and the force and the velocity is definitely more when compared to that of the pressure or the energy used in producing a linear fracture. The third variety of the fracture is elevated fracture. So here one end of the fracture, the one fragment of the one end is elevated over the surface of the skull and the other end is depressed into the cranial cavity. No, it is just a bending. So when a injury comes in a oblique way with a heavy weapon, then it will strike it, and when they pull the weapon outside, it may shell out, or the edge of this fractured bone, it gets elevated. So the other side it will be depressed, and one side it will be an elevated from the skull margin, from the skull surface. So this is called elevated fracture. And these are caused, I told you, with the heavy sharp weapon, and by the hit and when they try to pull it out, and this type of fractures are produced. The fourth variety of the fracture is a comminuted fracture. When I say the comminuted fractures, there are two or more intersecting lines of the fractures which divide the bone into three or more fragments. See, if the fracture lines are more than 2 or 3, depending on the number of the fracture lines, the bones gets into fragments. Can be 3 or they can be more. And this type of fractures are caused by a significant force striking over the broader area, like that which can happen in the crushed head injuries in traffic accident. See, when the head comes in between the wheel and the road, contact area is large and the pressure exerted on the skull is also large, and they can produce comminuted fractures with more than 2 or 3 fracture lines, and the bone fragments are definitely more than 3 or more. So if there is a fall from the height on the hard surfaces, or if there are repeated blows onto the skull with the blunt weapons, or if it is hit by a heavy iron bar or a poker, or even if it is a thick stick, they will produce the comminuted fractures. There are instances where the kicks by the animals have also produced comminuted fractures of the skull. And of course, this can be a complication of the fissured or depressed fractures. They can also become a comminuted fractures. And when there is no displacement of the fragments, there are a number of fracture lines, but the fracture fragments or the bony fragments are not disturbed. They are neither depressed nor elevated. They stay in situ. When they resemble, they retain in the same place. These fracture lines, they look like a spider web or like a mosaic, multiple lines, because bones are in the same place. They are not depressed. So only the fracture line, you can see multiple lines looking like the spider web or like a mosaic. So these fissured fractures, they may radiate for varying distances from the area of comminution, that is from the area of the impact. When the force is great, if the greater force is applied, the broken pieces of the bones which are seen, they may be displaced, or some of them may be pushed totally into the skull cavity. They may enter into the brain, or some of them may be lost. They have fallen down because the fragments, they can fall and you may not be able to locate them all. So these are the characteristics of comminuted fractures of the skull. There is another variety of the fracture which is known as a pond fracture or gutter fracture or indented fracture. No, it's not a gutter, it's an indented or a pond. So this is the simple dent. When there is a simple dent on the skull, normally as a result of, say, application of the obstetric forceps for the delivery of the baby, there is a pressure exerted on the very soft skull, and even with that little pressure what they use in the obstetric forceps, they apply, that can cause a simple dent on the skull. That can produce a indented or a pond fracture. Or if there is a blow from the blunt object, or if there is the skull is pushed against some protruding object, and this type of smaller pressures on the soft skin, on the soft skull, so they occur normally only in the skulls of infants. When the skull becomes little brittle and strong, this type of pond or indented fractures are not produced. So they normally occur only in the infants. The inner table is not fractured, but the fissured fractures may occur in the outer table around the periphery of the dent which is produced because of this pressure. So there is a dent, and along with the dent there may be a linear or fissured fractures. You can see sometimes in this type of fractures. And usually with this type of the fracture, the durameter which lines the brain, it is not torn or there is no laceration, and usually the brain damage is not seen in this type of fracture. So it says in the children, this type of small pressures, they produce a dent on the skull, that is seen on the ping pong ball. Another variety of the fracture is known as a gutter fracture. Gutter. I told you should be able to know what type of fracture we are going to speak when I say a gutter fracture. See, a gutter fractures, they are formed when a part of the thickness of the bone is removed. See, a part of the thickness is removed from the outer table and it forms a gutter. That is called a gutter fracture. So suppose if there is a bullet wound or any sharp fine object which hits the skull obliquely, and then it passes along the skull line, producing a damage to the outer table, and it forms a gutter. See, the bone is lost and it forms a gutter which is known as a gutter fracture. And they are usually accompanied by irregular depressed fractures of inner table of the skull. And because of this pressure, the tangential force, the oblique force which is applied onto the skull bone, there is a possibility that the meninges of the brain, especially the durameter, may be torn, and there may be damage to the brain. We will also discuss about another type of fracture known as the ring fracture or a foramen fracture. When a fissured or a linear fracture, it encircles the skull in such a manner that anterior third is separated at its junction with middle and posterior third. Or to be more, another way of telling is, this term, the ring fracture, means it runs around 3 to 5 centimeters encircling around the foramen magnum. See, the foramen magnum, and around 3 to 5 centimeters surrounding that, outside the foramen magnum, if you see this fissured fractures. And these fractures, they passes through the middle ears and also the roof of the nose, due to which the skull completely gets separated from that of the spine. And this type of the fractures normally occurs when there is a fall from the height onto the feet. When an individual falls from the height on the feet or the buttocks, the pressure passes along the spinal bone to the base of the skull, and a linear fracture is produced inside this. Linear fracture is produced encircling the foramen magnum, which is known as ring fracture. Excuse me for a minute. So fall from the height is not uncommon. So many times we see people working on the building tops while working on the real estate, the construction of the buildings. At least I have seen people falling while doing centering work and other works. They fall from second floor, third floor onto the ground. And if they happen to fall on the feet directly or on the buttocks, the pressure is transmitted to the wall along the backbone and to the base of the skull. And this linear or the fissured fractures that encircles the foramen, call it as a ring fracture or foramen fracture. And sometimes in very severe cases, the spine also may be driven into the skull cavity, or even if in very severe cases fall is it falls at a very higher speed, even the vault of the skull also may be blown out, like an explosive type of injury. So this is normally happens due to the fall from the height. Sometimes if there is a severe blow to the vertex, suddenly there is a severe blow onto the vertex, the pressure is transmitted to the base of the skull, and this also may produce a foramen magnum or a ring fracture or the foramen fracture. So even if there was a forceful blow onto the chin, normally in the traffic accidents, if an individual falls onto the chin, even if it happens even in the occupants of the vehicle, this pressure is transmitted along with the mandible to the base of the skull, and this may also produce a ring fracture. Sometimes this fracture is caused by sudden violent turn of the head on the spine. This we have seen in many movies where the hero will just twist the head on the individual's body, and when this sudden twisting movement of the skull onto the neck, when it is encircled, because of the shearing movement, there can be a fracture on the base of the skull surrounding the foramen, known as a ring fracture. So this is a sudden violent turning of the head on the spine. Another type of skull fracture we know, we call it as a perforating fracture. The perforating fractures are caused by the firearms or by the tip or the pointed sharp weapons like daggers or knives, or even with an axe. When this weapon passes through both the tables of the skull, and it leaves more or less a sharp clean cut opening, and it enters into the cavity of the skull, and the margins are clean cut, and their size and shape, they may correspond to the cross section of the weapon that caused the type of injury. So that will help you what could be the possible weapon, what are its dimensions, and if at all any weapon is procured from the site or any suspected weapon is sent to you for examination, you will be able to judge whether this particular weapon could have produced that injury which you have examined, because it leaves the size and shape of the wound which you are examining on the wall of the skull, that will correspond to the cross section of the weapon which caused that wound. There is one fracture which is known as the blowout fracture of the skull. Blowout fracture means there is a blunt trauma to the eye and the force are transmitted via the globe to the bony orbit, which causes fractures of medial wall of the medial wall and also the floor of the orbit I discussed earlier now. So they are called blowout fractures. The blow on the orbit, a blunt trauma causing the fracture of the medial wall or the floor of the orbit, which I discussed earlier now only. They are called blowout fractures. There is one more type of fracture which is known as a sutural fracture or diastatic fracture. When there is a separation of the suture of the skull because of the pressure, because of the trauma, if the sutures are separated, which can occur only in an young individuals, and this is because of the blow on the head with a blunt weapon. So when there is a hit onto the head with a blunt weapon, because of the pressure, the sutures get separated because of the trauma, the traumatic separation. We call them as a diastatic or sutural fractures. It can occur alone as a just separation of the sutures, or it can be associated with the other fractures of the skull bone also. And normally this type of fracture is seen in sagittal sutures, and these are again they are common in the traffic accidents, and due to these fractures are seen only in young adults. Sometimes when there is increased intracranial pressure due to various reasons, even sometimes because of the pathological, when there is increased intracranial pressure in an individual, there may be separation of the sutures because of the increased pressure. We call it as a diastatic or sutural fracture. There is another term expressed with regard to the fracture skull as expressed fractures. These fractures occur when there is the massive fragmentation and shattering of the skull, where some pieces of the bones may be found outside the head, and this normally occurs due to the massive trauma. Often it involves the contact or the close range firearm injuries. See, when you were studying about the firearm injuries, see, because of the impact of the firearm injury, this type of the expressed fractures are seen, and they are seen even in the bomb blast. The fractures, not necessarily they happen on the skull, outer or inner diplo or the vertex. Even the basal fractures of the skull also seen. I told you the causes, it can be due to the fall from the height, indirect pressure from the spinal cord onto the base of the skull, which produces number of fractures on the base of the skull. So what are all the complications of the skull fractures? See, the fracture, I think I'll just finish up telling the complications. The fractures of the anterior cranial fossa, they may involve the frontal, ethmoidal or sphenoidal air sinuses. So that leads to the loss of blood from the nose and mouth. See, normally you see when there is a bleeding, the head injury, the people come to your hospital with a casualty with bleeding from the nose and mouth. It's a common finding. And if there is a fracture of cribriform plate, and if the dura or the nasal mucosa are torn, the CSF may leak through the nose, or there may be a leptomeningitis, may be the result of the bacteria which can pass from the nose into the brain. And if there are the fractures which involve the paranasal sinuses, they may form a cranial pneumatocele. And if the fractures of the middle fossa passing through the basic occiput or the sphenoid bone, they may communicate with the mouth from which the blood will come out. Suppose if there is a direct communication between the cavity and the airway via the sphenoid sinus, and because it is produced with the fracture of the base of the skull, which involves sella turcica, the blood may pass into the bronchial tree. So the foci of inhaled blood are commonly seen in the lungs, and the death is normally instantaneous. And if there is a fracture of the petrous temporal bone, that may involve in the middle ear, so that can cause bleeding and also the flow of the CSF from the ears. So the blood may pass into the mouth through the eustachian tube, and that may be swallowed. If there is a tear of the posterior branch of middle meningeal artery, then it will produce copious bleeding from the ear. If posterior fossa fractures, there may be extravasation of the blood into the soft tissue into the back of the neck. And in case if the fracture reaches a foramen magnum, there may be contusions of the cerebellum, or because of subsequent edema, they may even herniate through the foramen. Sometimes even the cranial nerves may be injured because of stretching or because of bruises or contusions. There may be signs of the shock, and these injuries may become the port of entry of a bacteria into the brain and lead to the septic meningitis and leptomeningitis. And there can be a fat and bone marrow embolism. And if there is a depressed fracture of the skull, that may exert the pressure onto the brain, causing severe dysfunction of the brain, and it may lead to the coma and the death. So these are all the injuries that can happen in the skull, the head. In the next class, we will discuss about the injuries to the brain, injuries to the meninges, and also, if possible, we will talk something about the injuries to the spinal cord. Thank you. Wish you a safe day. Thank you.